All right, so this has been an extremely informative discussion. Before we end the discussion, I'd like to get some final thoughts from each of our panelists. So, John.
Well, thank you very much, Ola, for having me here today. This has been a lot of fun, this conversation. So I'm a pediatrician by training. I'm not an oncologist. I can pronounce drug names, and that's about as far as it goes. But what has impressed me about this conversation is that with the more and more options we have, the less and less we know about what optimal therapy is. We talked about the need for more predictive indicators of who's going to be a long-term responder and a long-term survivor. When can we stop therapy? What's the role of transplant in this new era when we're getting a very high MRD negativity with initial induction therapy? These are all questions that need to be answered. The fact is we're going to continue to pay for these very high-cost regimens, and the onus is on us to try and understand how do we optimize the outcome and minimize the financial toxicity to patients and the financial cost to society as a whole. So I'm excited about the opportunities, but there are lots of challenges ahead, and with the more and more information we've had, the more and more questions arise as to how do we best produce the best outcome at the best value.
Sundar, what's your take?
Well, I'm seeing patients in the clinic every day, myeloma patients. So my perspective is that there are three areas which are, this is an exciting time to be in the field of myeloma and taking care of the patients. Why I say that, number one, our understanding of the biology of the disease is improved. Understanding the tumor biology, the tumor microenvironment with the latest CyTOF and other technology which has come. Second is there is a number of new drugs. We talked about all the different combination we could use, monoclonal antibody, the proteasome inhibitor, new drug, selinexor just got approved, and the future with bispecific antibody and CAR T. So it is a watershed period, and more patients would be cured. So it is easier to approach a newly diagnosed myeloma patient now than, say, 15 years ago. So that's the second aspect of it. And the third aspect is the development in understanding the depth of response. Before, we were looking at the serum protein electrophoresis, and we always said the tip of the iceberg. As well as the tip disappeared, we were happy. Now we are actually able to see the entire iceberg, all the depth. And so we are able to utilize these new drugs to the maximum benefit and see we actually eradicated the cancer in the patient and follow them. So development in understanding the biology, multiple new drugs available, and future is even brighter, and the technology to understand the depth of response, all of them have come, and that makes it very exciting.
That's an excellent summary. Thank you all for your contributions to this discussion. On behalf of our panel, we thank you for joining us, and we hope you found this peer exchange discussion to be useful and informative. Thank you very much.